Good afternoon. Welcome. We're going to get started. I'd like to welcome you to the Physician Assistant Education Association Encore presentation of the talk, New Benefits to Being a Preceptor, How to Earn Category 1 CME for Teaching Students. Before I allow our speakers to introduce themselves, I'd like to just take the time to remind you, as a courtesy to our speakers and other attendees, to please silence your cell phones. Please, if there is time for questions at the end, please use the microphones in the aisles on either side to ask questions. We are recording this session and would appreciate if we have questions on the recording. Also, please remember to take your personal belongings and any trash that you have with you when you leave. And just a reminder that we do not allow video or audio recordings of these sessions. I also would like to point out that the PAEA, Physician Assistant Education Association, has offered several talks throughout the conference. The next one that may be of interest to some of you is tomorrow at 11, entitled Exploring the Transition from Clinical Practice to Physician Assistant Education. Have you felt the nudge? So if you are thinking about PA education as a clinician and you're feeling the nudge, you might be interested in that talk. It's in this room tomorrow at 11. And now I would like to present New Benefits to Being a Preceptor, How to Earn Category 1 CME for Teaching Students. Thank you.
Thank you, Jonathan. Can you all hear me in the back? A wave? You're good? All right. My name is Michel Statler. I am the program director at Rosalind Franklin. In my previous life, which was 1 month ago, I was a senior director for academic affairs for the Physician Assistant Education Association. My co-presenter is Carol Gorney. Carol is the clinical coordinator at the University of Iowa's PA program. Carol is also the chair for PAEA's Clinical Education Committee. And so what we wanted to talk to you about, why you're all here is for the Category 1 CME component of that, but we also wanted to talk to you about some other benefits for precepting. And so we want to talk to you about not only the tangible but also the intangible benefits. Some of those intangible benefits address some of the core competencies for the profession, specifically the professionalism competencies. But as I said earlier, the real reason that you're here is you're intrigued about the possibility of being able to claim Category 1 for clinical precepting. One of the biggest challenges that PA programs have are finding new clinical preceptors and keeping those good clinical preceptors. The reality is we have 170 PA programs. We have a number of programs in the pipeline for development. And so programs are competing with programs. Programs are competing with other healthcare disciplines, whether it's allopathic or osteopathic medicine. But those clinical training sites are our very precious resources, and everybody wants to hang on to those really good clinical preceptors that they have. And so if we know that one of the big challenges is finding preceptors and keeping those preceptors, then how do we find out why some PAs choose to be preceptors and others say, no, thank you, we really aren't interested in doing that? So in 2011, PAEA's Clinical Education Committee did a survey to all clinically practicing PAs in the country. We had a response rate of over 11,000 PAs, so response rate was about a little over 15%. And what we found out of the people who responded to that survey, about 25% of those respondents were still currently precepting PA students. 75% of those respondents, though, were not. And they were either someone who had precepted previously and wasn't doing so currently, or somebody who had never precepted students. The one comment that we heard over and over again from those who had never precepted was, nobody's ever asked me. So now we're asking. And so one thing that we actually had included at the end of the survey was, if you're interested in being a preceptor, check this box. We had no idea when we administered the survey what type of response that we had, and we were actually overwhelmed. And we ended up, out of just that survey activity alone and asking, with 1,500 new preceptors that we were able to connect with different PA programs around the country. The other thing, which was the real goal for the survey, the preceptor database, which was a nice benefit, but the real goal for the survey was to really outline what the benefits or the incentives were for precepting, but then to also look at the potential challenges and barriers that were there so that we could address those and hopefully fix those. So if you look at what our current preceptors said, what were the most important reasons that they chose to precept students? Right at the top of the list, 90% of them said it was giving back to the profession. A close second to that is people found that teaching was rewarding and they enjoyed working with students. And then about 78% said, you know, working with students keeps you on your toes. And so that's one way, you know, they ask all of these questions. And so it's one way for you to keep up to date in terms of your own medical knowledge and your patient care skills. And then you can see some other things there about giving back to the program where you got your training, bringing prestige to the practice. Hey, look at this, we've got PA students. And then it's a nice way to find maybe a new employee. So you're working with a student and you find out, you know what, we need another PA in the practice. You've worked with them, you found out that this is a really good person. And so then eventually you want to hire them and have them join the practice where you're working. Some of the benefits, I'm going to scoot down to benefit number 2 because benefit number 2 is no benefits. And so about 40% of PAs who are serving as clinical preceptors currently don't get any benefits other than what we just described about giving back and keeping up to date and just finding what they're doing to be personally very satisfactory. But the number one benefit today really has been CME credit, but that has been defined as Category 2 credit, not Category 1. Other benefits that PA preceptors get are highly variable from the programs that they work with, but some of those things have included adjunct faculty appointments. With those faculty appointments, and they have the ability to have access to the library. They may get free or reduced access to review courses and other types of CME activities at those particular programs. But as I said, it's variable between programs, what different programs are going to be able to offer to thank you for serving as a clinical preceptor for them. The other incentives, and this is a very, very busy slide, but top on the list is if you really want me to be a preceptor, you got to make that Category 1 CME credit happen. Category 2, I can get for anything. I can watch an episode of Grey's Anatomy and I can claim Category 2. And so I've got lots of things I can do for Category 2, but the real money is having that Category 1 CME. So that was top on the list, and 63% of people said that would be the most important benefit for them to make the decision to go ahead and start working with students. The other things that come out of there is if you're, and you probably see this already within your own practice, if you choose to work with students, you know how important it is to have the support of your supervising doc, because if you don't have that, it's not going to happen. You need to have the support of the administration for your clinic or your hospital, because here again, that could be a potential barrier. And you also need support from the program, because the other thing that comes out of this is, you know, I want to be a preceptor, but I really don't know how. And so how can programs provide preceptor or faculty development to help you know how to be a preceptor and do the job really well? So if you look at a number of different models, all the different variables that factor in why a clinically practicing PA would choose to be a preceptor, it goes back to what we found in the survey. They want to be able to contribute to the profession and give back in a meaningful way. They also want to improve their own core knowledge and patient care skills. And they also want to be able to better manage their time within the clinic setting. What do they want from the PA student? They want a PA student who is motivated to be there, who is excited, asking questions, who's professional, that has a good knowledge base that you can help build and mentor them on their professional development. What you want from a program, if you're a clinical preceptor, is you want support. You need to be able to communicate with the program. It needs to be a two-way dynamic. If there's questions, concerns, the program needs to be a good resource for you, and provide some faculty development if that's something that you're particularly seeking. And then the other component are the day-to-day realities of what's happening within your practice. How do you balance the need to be efficient and timely in terms of seeing your patients, have the appropriate space available, again, so your practice runs in an efficient manner. So what's on the flip side of that? And we've kind of alluded to that with some of the things that we don't have. And so if we look at some of the potential obstacles that we found in terms of the survey respondents, that lack of support was front and center. And so whether you define that by lack of support from your supervising doc or from the administrative offices or from the PA program itself, all of those things were potential barriers for people working with students. And it may in part explain some of those preceptors who used to work with students and chose to no longer work as they didn't feel that they had the support they needed from any one of those particular venues. The other thing that came up was the quality of students, which goes back to one of the models that we just looked at. If they're there and they're not motivated, then that makes it harder for you to get excited about teaching. If they lack professionalism, again, that's another potential barrier. And so the quality of the students that are coming to your site is an important consideration. And then one thing that comes up on the radar, and it's a thing that we don't like to talk about very much, but it's the possibility of financial compensation. And it's something that probably when you were in school that was never even on the table for discussion, but it's something that's becoming more prominent in terms of a reality because of the competition I referred to earlier, not just between PA programs, but within medical schools and other healthcare disciplines. Everybody's fighting over that same piece of the pie, if you will. So if you look at what those current variables, current benefits that are out there, again, as I said, this varies a lot between programs. The Category 2 CME, you can have in abundance, and a letter from the program can verify that you've served as a clinical preceptor for X number of students over X amount of time, and so you can turn that in as evidence that you have been working with students. You can also get an adjunct faculty appointment that's going to allow you to have access to a number of resources that are available at the institution, and probably high on that list is access to the library. So if you want to do some research, you want to do some online journals, things like that are a real nice benefit if you don't have those available already within your practice. I mentioned earlier that having access to board review courses and other types of CME activity is a nice perk that programs can offer to their preceptors as a way of saying thank you. And then there's the professional development or the faculty development resources that can be provided. Some of the resources that PAEA has available for preceptors are available right off of our website. So if you go to the PAEA website, which is paeaonline.org, there's a tab right at the top that's just for preceptors. So when you click on that tag, there's a link to a handbook for preceptors. There's also a number of links to other resources like the 1-minute preceptor and strategies for giving feedback and how to be more time efficient, because when you're bringing a student on board, how do I work them into a really busy practice and do that well? The handbook is currently a member benefit, meaning that it's only available to the PA programs. But if you serve as a clinical preceptor for the program in your area, they can get access to that for you and provide you a copy of that particular guideline. What that handbook is designed to do is help you define what's your role. What is your role as a clinical preceptor? What are your responsibilities when you are working with students? And similarly, what are the roles and responsibilities for the students? What are some guidelines for Medicare, for documentation, for writing prescription? What is going to help you work with those students better in the day-to-day? And so all of that is compacted in this preceptor handbook. And at the end of the handbook, there are some additional appendices with some additional resources. Again, how do you give feedback? If you're not used to talking to students, it's really easy to be the cheerleader and say, hey, you're doing a great job. But on the other hand, if you need to give them feedback and kind of redirect their behavior, that's a little more of an art form of how do you do that constructively such that they hear that and you see a positive change in terms of their behavior at your practice site. So a number of different resources are in the handbook, very similar to some of those that are also accessible from that PAEA website. So I'm going to transition over to Carol. Carol is going to talk to you about some of the joint initiatives that PAEA has been doing with AAPA.
Thank you, Michael. Mm-hmm. Hi, again, I'm Carol Gorney. Can you guys all hear me still? I work in education at the University of Iowa, and I chair the Clinical Education Committee for PAEA. And I'd like to thank Michael for that recap for our survey and the results. And that's a beautiful short recap, but that's actually a labor of love for over 3 years. We were tasked with finding resources for the clinical year, for site development and helping our preceptors. So this really has been a long process to bring this to fruition. PAEA, as well as the AAPA, have worked very hard in a partnership and a strategic plan to support the PA profession. 3 of their main strategic plans are the Drive for Excellence, optimizing the PI profession, and growing the profession. We really want to make sure that we increase our numbers, increase our visibility, elevate the role of PAs, make sure that every PA can practice in a setting that they want to, and that we have a broad range of PAs and a nice diversity. And one of the rate limiting factors in this has been actually finding preceptors. Programs can't grow. We have a difficulty in finding enough clinically active PAs that are willing to supervise students in the clinical year. And so our mission kind of grew from that. And so we are going to explain the category CME a little bit. Let's see. I want to first talk about a few joint initiatives. I think it's very nice that both these organizations are working very collaboratively to bring a lot of information and work together to provide PAs with the support they need. The preceptor recognition and category CME1 are 2 of the projects that are on the forefront that we're working on, and you probably have all heard about the Paragon Award, and I'm going to spend a little bit more time on the clinical preceptor recognition program because I think that's a little bit newer and a lot of you may not know as much about that before we roll out the CME. So the Paragon Award is given annually at this conference, and that's tomorrow. So if you're not attending, I encourage you to buy tickets and attend that. It's designed to honor one preceptor. There are several criteria for this. You have to have precepted in the previous calendar year. You have to have precepted for 3 consecutive years, and you have to have precepted for a minimum of 3 students to be eligible to get this award. And so we'll be participating in this event tomorrow. So again, I kind of encourage all of you to attend that. It was today? Oh, I apologize.
No, Paragon's Tuesday night.
Paragon's Tuesday night.
Challenge Bowl is tonight.
Oh, it was announced, but the ceremony is actually tomorrow night at the Paragon Awards. Okay, I'm like, oh. Okay. Sorry about that. I'm like, oh, I missed it. I'm in trouble. So, back on task. The Clinical Preceptor Recognition Program. This is the newer program to recognize clinically active PAs who are precepting. It is something that I think is near and dear to my heart. I precepted for many years. It's where you can get credit in your practice, in your program for yourself for actually being a clinical preceptor. To be eligible for this, you have to meet all of the 3 categories below. You need to be an AAPA fellow member. You need to have served for a preceptor for more than 1 student. So right when you take that second student, you're eligible to be a clinical preceptor and get this certification. And you also need an endorsement from a PA program. If you precept for multiple different PA programs, you only need one of those programs to endorse you. And when you become a clinical preceptor, you'll get a certificate of appreciation and recognition. You'll also get a little lapel pin, and you can claim this credential, much like a distinguished fellow. It is actually a self-nomination process, so if you're interested in getting this credential, you can go to the AAP website, you can click on the membership tab, and then you can fill out a form. There is a one-time fee. That's also where you'll find the endorsement form to have your local PA program fill out an endorsement form for you, and then you can use this credential. There's many initials. I don't like to use them all. I just say CP. But I really do encourage you to self-nominate yourself and to utilize this. It looks good on a CV. It gives you credit in your job for extra work you're doing. We're not kidding anybody that taking students does not take more time, more work. It is definitely an addition to your workload, and so we would strongly encourage all of you who are taking students and who are putting in this work to apply for this recognition and utilize this recognition. it's important for all of you to get the credit for the work you're doing. Okay, so now the CME. We're finally getting to it after all this time. Okay, so again, this grows out of 3 years of work and labor, and as one of the most identified incentives for taking students would be to earn Category 1 CMEA, Category 1 CME. AAPA and PAEA have worked quite long and hard to develop a process to allow Category 1 CME to be awarded. You'll be able to earn 20 credits per cycle, so 10 credits per year for precepting students. Who's eligible? It's a little bit different than you might think. It's actually going to be an application process. PA programs will apply to be able to give this credit out. They do have to be ARC PA accredited programs. So programs that are in the pipeline and not yet accredited won't be able to award this yet, which they really shouldn't be because they shouldn't have clinical students yet. But different individual institutions like a hospital, a small clinic, an individual preceptor will not be able to give out this credit. It will be the PA programs who are assigning students to the preceptors that will be doing this. So the PA program will apply, and then they will get approval through the AAPA after they've submitted their application, and they will have the authority to give Category 1 CME to the preceptors who are currently clinically teaching.
Is it going to cost the program anything to apply?
There is a small fee for the program to apply. It's a very nominal fee. Right now, only PA preceptors will be awarded Category 1 CME. This is approved by the AAPA. So the current working model has PA students and PA preceptors. The preceptors also have to be fully licensed to be able to be eligible for this Category 1 CME. And they have to disclose any financial relationships or commercial relationships that they have. And I do want to remind you that all the other regulations and standards for CME apply to this type of CME as well. The PA programs will do the bulk of the work for the preceptors, and it is going to be relatively user-friendly. I've seen the model, and they're working on some worksheets and some things to make it quite friendly. The PA programs will provide information about the sites, the background, the type of setting, inpatient, outpatient, family practice, internal medicine. There will be some baseline information that the programs turn in once a year, and then they'll be, once they put their application in, they will be able to give Category 1 credit to unlimited numbers of preceptors, no matter how many they want to, who are qualified, whether it be 10 preceptors or 100 preceptors. So there's not a finite amount, and there's not more money to give more preceptors credit. There's just one fee. They'll also then work with the AAPA to see what programs and what preceptors are eligible. And then based on a preconceived formula, they'll determine the amount of credit you'll receive for precepting the students. And I will explain that in just a minute. There are learning objectives. And when this was presented to me, I found this a little confusing. I'm just going to do a little needs assessment. Who here is in education? Okay. And who here is clinical preceptors? Okay, so a little bit of both. So I do both myself. So I wear both hats. So I get objectives saying, hey, you're taking my student in OB-GYN. Here's the objectives I want them to learn. I'm a program. I give those same objectives to someone else and for family practice. And those are the students' objectives. There also will be 1 or 2 objectives from the program for you as the preceptor. If you think about CME, what's the process of CME? We're supposed to be learning or developing or presenting skills ourselves. So there's different types of ways you can utilize precepting as I'm going to practice my professionalism, I'm going to improve my medical knowledge, I'm going to work on my interdisciplinary skills or team approach. And as you teach those to the students, it can be a process of self-improvement. So that's kind of where the second step of objectives comes from, what you're getting out of this experience as well. And that makes it eligible for the Category 1 CME. So there's just a few more examples of that. You know, you can set great professional standards, ethical standards, teach your students conflict resolution, and that actually helps you grow as a professional and a provider as well. So this is kind of the process in a nutshell. The PA program will submit annually. They'll get their approval. They'll be able to start rolling this out, and this will all be done in the background, so things will go like normal. Clinical rotations will start in July or June, and while you're taking all these students, the program will be accumulating information on you, and then at the end of the year, they'll be able to get you a certificate for the number of hours that you're eligible for. And then when that's all said and done, they'll submit to AAPA, they'll reconcile everything, and the preceptors will be able to submit for the Category 1 CME. So, the actual calculation. Preceptors can be awarded half of credit per 2 weeks of clinical teaching. In most programs, they found there are very few rotations that are under 2 weeks, so these are kind of broke down by weeks. Preceptors will also be eligible to earn additional credit if they take more than one student at a time. And using this calculation, this is just kind of a rough setting for weeks. If you're the type of preceptor that does it more longitudinally, I can't speak today, longitudinally, then you can actually, if you do it 1 day a week all year long, they can calculate your CME based on that if you don't do it in a traditional number of weeks. But you will earn just a maximum of 10 credits per year, 20 per cycle. The programs will reconcile everything at the end of the year. They will determine how many credits each preceptor will earn and the number of preceptors per institution or for that entire program that will get the credit. Then when the preceptors go to log their CME credit, they do not have to pay any additional fees or monies for that whatsoever. So we think that's a nice benefit for all the clinical preceptors that makes it worthwhile. For those of you in education, the reconciliation point, I kind of panicked when I heard that, and then my brain started kind of clicking and turning. How can I make this work? Most programs have logging systems, eValue, Typhon, or some sort of records for their students. And so I've already called my logging system and said, hey, I need 2 different rankings for my preceptors. I need PA preceptors. I need non-PA preceptors, because I need to collect the data separately on all my preceptors that are PAs that I'm going to be able to award this credit to. So I've already set up my little system before this rolled out so I can data dump what preceptors are precepting, how many hours they're precepting, how many weeks, and how many students. So they're trying to make it as easy as possible. And AAPA is planning on rolling out some examples for you and how to do that, what the worksheets will look like, what data you need to collect, examples of the certificates you can give to your preceptors, and make it as user-friendly as possible. Here's kind of the complex chart and why they came to the numbers they came to. This is what CME is going to look like when the PI self-assessment portion comes in. 50% of your CME is still going to be allotted to Category 2. 20% will be your PI or self-assessment. Up to 20% can now come from precepting clinically active students, and then that leaves 10% for traditional conferences and things like we're doing today. If you opt not to precept, obviously, depending on the amount you can get more in your conferences, but it gives a nice broad range of Category 1. And this will also kind of continue to help our preceptors want to precept on a regular basis. We admit that. I think it's important to keep our preceptors engaged and offer them a benefit throughout the clinical year. And this is the timeline. Their AAPA is currently finishing developing the system and coming up with all the resources. They will then be doing a pilot test for it, and then a few target programs will piloting and seeing how the data can be collected and how the system works. And then it is expected to roll out in July, so this credit will actually be available this year. So we're very excited about that. So the take-home points, when all are said and done, is AAPA and PA continue to work very hard and collectively to try and support the needs of all the PAs, the workforce, the PA programs, the educators, the clinically active PAs. We want to encourage our preceptors and find as many resources as we can for them. Category 1 is officially available this year after a long process and a lot of hard work by many, many people aside from me. So I'd like to thank them. The PA programs will be the one that give you the CME. AAPA will give the authority to the PA programs. It is currently only available for PA students and PA preceptors. AAPA does not have the authority to award credit for physicians or other things. Those talks may be in the future and something to look forward to offer more resources, but right now it's PA students and PA preceptors. Preceptors will pay no additional fee, and I think that's really important. It does make it definitely an increased benefit for the preceptors, and a well-deserved one at that. And we will continue to work quite hard to give you guys resources and support for the clinical year wherever we can. Any questions?
Could I just ask that if you do have questions that you approach the microphone? That will help us. Thank you. And then I want to remind everyone that the evaluations, we have paper evaluations for this session that are yellow. If you wouldn't mind filling those out, that'd be helpful. Thank you.
Could you comment on what NCCPA has interpreting this new process? Are they in support of this process?
Yes, this is approved and can be logged through NCCPA. Would you like one?
Question. I'm not too familiar with the NCCPA's current nomenclature they're using for the new cycling, the 10-year. There was something about PI assessment and some other one I'm still not familiar with. But can these credits be used for those, I don't know if you're familiar with them, there's supposed to be 100 credit hours, of which 20 has to be self-assessment and professional improvement. Are these just plain CME, or can we use those for those credits also?
These are different than the PI self-assessment.
Okay.
They're still rolling that model out, and I'm not as familiar with all the examples of that yet, so I don't know whether a project could be used out of these, but these would be logged in the other allotment of Category 1 CME.
Just kind of a bookkeeping item. Excuse me. You keep saying that it's 10 per year or 20 per recertification cycle. If somebody joins as a preceptor in the second half of that cycle, can they earn the full 20 in the second year, or are they limited to 10?
It's 10 per year.
Okay.
Just a quick question about the July start date. If I have a student starting July 1st, it would basically that any credit would be maybe toward the end of July that I would get. Is that correct?
I believe it will be.
Okay. I mean, that's not, obviously I didn't know about this before I took on a student, but it's good to know.
Yeah, I think it will grandfather back to July 1, so the roll-up for July.
Beneficial for me. Okay.
Hi, so I'm coming from the educator side. I'm the clinical coordinator, and the part of this, I think this will be great for recruiting new preceptors, but the onus of collecting the data is falling to the programs. It's going to be up to the programs to collect the data and then submit it in as accurate a way as possible. And I'm wondering if any thought has been giving preceptors access to some kind of logging system outside of the program. Is it conceivable that either AAPA or PAEA could conceive of some logging system where the preceptors could just go in and directly log their hours, as opposed to submitting it to me, who then has to keep track of it and make sure it's accurate and then submit it? It just seems like on the program side, it's going to be pretty labor intensive.
It does, and I'm a clinical coordinator also, so that popped into my head immediately as well. And so there actually has been some thought on what type of information will be needed. AAPA is trying to develop an Excel worksheet and then work with the logging systems. So as a clinical coordinator, you could data dump quickly. I have this many PAs that are serving as preceptors to PA students. They're in these specialties. There are just several columns of information, number of weeks they precepted, and actually pulling it out, because the program is going to be actually ultimately responsible for awarding it, but they're working on some models of worksheets to make that user-friendly. And there was also discussion with some of the logging systems on how could we make this efficient in just pulling 3 or 4 different types of data and run just one report off of a logging system.
And is it, did I understand you to say that for preceptors who may be, say, in the emergency department, they precept a student on Monday one week and then Tuesday the next week, and so it might take a while for them to accrue 2 solid weeks. There's a mechanism for accounting for that.
Yes.
You just add it all up.
Yep,
And
correct.
a week is considered 40 hours?
They have not even been quite that stringent. The PA programs will use their average hours for a week.
Okay.
The other thing I would add to that is that all the data that you're collecting on the preceptors and the sites, it's information you can then turn around and put back into your self-study documentation for evaluation of what you have in the clinical year.
And I'll reiterate that because most of that information is something you have. You know how many preceptors you have. You know how many students they're taking. You're getting those through evaluation processes and information. So if you have like a central logging system, the examples of the spreadsheets they're rolling out that'll be made available, as well as examples of the certificate you can give to the preceptors that they can keep on hand and things like that. They're going to make several examples available.
As far as the fee structure for the PA programs to actually become CME providers, is that something we can find online or something you can tell us about? Or?
I believe the fee, I don't know if anyone from AAPA is here, was $200 a year.
Okay.
So it's a nominal fee, and that includes whether you do 1 or 1,000 preceptors.
Okay.
So it's not per preceptor. It doesn't get exponential. It's just a nominal fee, I think, to cover paperwork.
Okay, great. Thank you.
Shameless plug here. For all of you clinical coordinators who overworked and looking at having to fill in some more paperwork to get your CME stuff, one way we can save some time for you is we have a product called end of rotation exams that Michael developed, and along with many other folks. And if you'd like to have some more, find out some more information or how you can get those for your program, a couple of us from the office will be in the back of the room afterwards.
Thanks, Tony.
The one thing I'll mention, certainly I don't want to endorse any logging system or this or that. I'm up here talking for PAEA and our committee, but I've actually, since I was privy to this information, have looked at the provider I use, asked them to separate the categories, looked at what's on my evaluations, how I can add 1 or 2. How many weeks did you precept this student? So I can pre-populate number of students, number of weeks, if they're PA preceptors, and just with one click of a button, download all that information for all my preceptors in 1 year. So the wheels are already spinning, and I'm happy as I get that rolling to share that with anybody. So if you feel free to contact me through PAEA. Do give me a week or 2 to get home and get this sorted out, but I'm happy to share with anyone.
Just one last question, just for clarification. Our physicians are not getting Category 1 for this. We can't submit to AMA and let them decide if that would be a Category 1?
Right now, they don't accept AAPA Category 1 as their Category 1. So I think that's something that is certainly on the horizon, and that there are powers that be that would like to have those discussions. Right now, in the physician realm, the American Academy of Family Physicians do offer Category 1 CME for their students, but they don't get that credit for PAs, DOs. They don't cross across any of the boards right now. So how those conversations play out is yet to be determined.
Okay, and we're also planning to use our system for Typhon to keep track of our preceptor hours as well.
And I do think a few little tweaks in any of those systems will make it very user-friendly.
Some of the PA programs where I'm from are insinuating paying the preceptors. Is that going to have an impact on whether we'll be allowed to get a Category 1 or not?
No.
Okay. All right.
Just a quick question on depending on the hours, if a preceptor wanted to select and apply some of the precepting hours to Category 2 based on the limitations, can they, if they meet the 10 per year, can they then track or?
As far as I've been informed, they can still claim some Category 2 as well. They can do the 10 for Category 1, and then they can do the limit for Category 2 as well.
And if there's a number of PAs or in the practice that participate in the precepting, just I think as the example with the ER, if it isn't every day that you're specifically spending time, but obviously you're the connection for the practice, how is that kind of handled?
The program, so the guidelines are not that strict, and purposely so, like you have to take this student for 8 hours, 5 days in a row, and that's a week. However you do that, if it's like you do 12s, you do 24s in the ER, whatever you do, the program has to determine what they essentially feel a week of precepting is. If it's 1 day a week for 5 weeks, that's a week, you get that credit. The PA programs will have some flexibility to keep track of that and determine
And
that.
you can work with the program and kind of
Yep.
explain how you are, and then they
And
can
I think that is a
identify.
great place where whatever tracking system you're using to keep track of your students' hours can be utilized.
Sure.
I know I work with someone from the Denver program, and they start a year earlier, and they have preceptors that just take a student once or twice a month the whole time for an extra year, and so they'll be able to accumulate those as well.
Okay, thank you.
How will PA preceptors be advised about this registration process with individual programs? Will we receive some public notification that the registration period is now open and contact your program of choice, or will programs be initiating the contact to their preceptors, or who will initiate that? Do we have to bug them, or will they bug us?
So the programs are the one that are responsible to register with AAPA, and then AAPA gives the programs the authority. So I already plan on like mass spamming my preceptors to let them know about this. And so I think there will be more information and examples forthcoming, some PR information, the worksheets, the Category 1 CME. If you have, we're encouraging state constituent chapters to put a blog or something in their newsletter and let preceptors know that this is available, because a lot of them don't know. So we're trying to encourage people to put this on the map and let it be known. But I do think there will be some information forthcoming from AAPA as well.
Thank you, Carol and Michael.